Okay, in the second part of my presentation, I focus on self-help and self-organization of drug users in Germany. I do focus on a network called YES. It's an abbreviation, JES, Junkies, Ex-Users, Substitutees. And since 1989, the German AIDS Help supported the process of self-organization of drug users by financing meetings of drug users in methadone treatment or with the former drug users. So you see here, it's more than 30 years where the German AIDS Help, which I described in the first part of my presentation today, where the German AIDS Help supported the process of these self-help organizations themselves. And by now, we see that the network of YES has been founded in 1989 in Hamburg. And this is a nationwide network of local groups of YES that have been established as part of the AIDS Help organizations. And these were done and they have their own identity that was based on the self-perception of being an advocacy foundation for fighting for the human rights of drug users. In 1989, I just say that, and taking out of their foundation declaration, it was said that drug users, like all other men and women, have a right of human dignity. They don't need to obtain this right through an abstinent and conformist behavior. So that is taken out of the founding declaration, and the importance of self-help organizations and self-help itself of people who inject drugs. That is the abbreviation here, people who inject drugs. That is very clear. And I think this has gone into the planning of drug services and drug policy in many municipalities and many länder, and even on the federal level. People in peer groups or in peer-driven intervention, they are highly accepted within the scenes of people who inject drugs. The peer-to-peer transmission of messages and the self-help paves the way to professional facilities of drug users. I just said that on the example of detoxification or housing. That is another good example, which is being done from self-help to professional services. It increases the sense of responsibility for one's own health and life, and for the health and life of other drug users. So there's more interest once it is, let's say, systematically connected, the relationships with each other. It increases risk awareness and the ability to prevent health damages such as infectious diseases or infections with HIV, hepatitis C or B, or COVID-19. The typology of self-help groups is that self-help offers more opportunities for participation than the official health services. It is completely clear that people who help themselves, the peer-driven approach, is going far beyond what can professionals do in terms of acceptance of certain services, in terms of trust, it is of a basic necessity. Self-help means active involvement in the overall process of subcultural social structures, accepting our lifestyles and giving a non-moralizing message aimed at prevention of infectious diseases. What I mentioned is professionals, they could not do any safer use training. So we need people who were using drugs themselves in order to get to know the different situations in the everyday life of drug users. When a needle is there, but there are 5 people who want to use drugs, but only 1 needle is there, what can they do in order to prevent themselves from HIV or hepatitis C? And the same accounts for safer sex among men or among men and women. And also with regards to safer work for sex workers, lots of good trainings, manuals have been developed in order to prevent people from exposing themselves unnecessarily to risks. And that never could have been done by professionals, by academics, because they do not know the living conditions of drug users themselves. Self-help means helping each other to maintain an independent identity, to strengthen the identity in a target group or in a population which is suffering from discrimination and stigmatization to a huge extent. And that finally leads to a loss of self-esteem, so that people think they cannot do anything successfully anymore. So they lost confidence in themselves. But it needs the fact that self-help strengthens each other and other drug users. And self-help means respecting human dignity. So self-help is demanding society to care for them, to respect them in their human dignity, and to make their living conditions worth living in it. So drug users can speak and act on their own behalf, but they need, first of all, or in the beginning, a certain sort of a frame, a certain sort of support in order to get it done, because criminalized populations, they cannot hardly manage to find themselves, to found themselves as groups. They need, in the beginning at least, some sort of external support. And in the example of YES, this has been done quite successfully. And the professional drug help system can involve drug users in order to promote self-help resources. For instance, the take-home naloxone. The provision of naloxone can best be done by cooperating and collaborating with self-help groups. And finally, to jointly enhance drug policy with, for instance, new regulation models. Good, and we were talking about services and activities. The provision of take-home naloxone is one major task self-help is doing. Information about opiate substitution treatment, about addresses of doctors who have places free where people can access OST without a waiting list. Public relation lobbying, of course, that means the change of local drug policy or on the federal level, that is very important. And finally, changes in health and drug policy. That all is something self-help groups do, and much more, which I cannot point out and develop here. And the aspects of successes are that self-help is getting together a broad variety of autonomous groups with common aims. We will see that a little bit later on. A cooperation between active drug users, ex-users, and people in OST. So they should not discriminate themselves. They should join and jointly be aware of structural discriminations and stigmatizations, and they do so. They are a partner organization who supports YES without monopolizing. This is here at the German AIDS Hilfe, and meetings for the exchange of experiences and knowledge between drug users are very widespread. They show trust, or in these connections, trust is being built, and that is of huge importance. And self-help groups are active on all levels, local, state, and federal level. Promoting the self-help of drug users is possible with material and ideational support. Of course, it's based on equal partnerships. A helper-client relationship would be counterproductive. That is not what the connection between professional drug services and self-help should look like. They should bring people together who are interested in self-help and self-help organization. And Support in matters of public relation and lobbying is necessary. And finally, an involvement in professional and political working groups. The forms of financing are different. We see that at the example of YES, as I told you, junkies, ex-user, and substitutees. This is the abbreviation, YES. The most of them, of the members of YES, are all volunteers. Only, let's say, one full-time job for German-wide coordination. The German-wide workshops, regional meetings, they are financed by the Ministry of Health in Germany. There's a cooperation on local level with AIDS Help and drug services with regards to office sharing, telephone, fax, and computer. And yes, offices in several cities are financed by the cities themselves. And the assistance is different, and the support. In Germany, the statutory health insurance funds are obliged to provide financial assistance for self-help groups, no matter which target. But necessary is the inclusion of self-help activities in the planning of addict support measures at federal, state, and municipal level, the provision of qualification opportunities for self-help groups, and the provision of venues for meetings free of charge. So self-help groups, including parental self-help groups, should be included to a greater degree in the coordination and planning activities surrounding measures to reduce drug-related problems. And what can be seen from YES, again, they're very active in the prophylaxis of infectious diseases with the needle and syringe automats they are running, with brochures in many ways, and clear, for instance, work on manuals like here on hepatitis and drug use, and certain practice-oriented institutions. So yes, is very much widespread, and brochures and leaflets, which are very target-oriented, gender-specific, and which are very much focused on the key issue and the key message in the language which other drug users can understand. This language is not academic. It is, of course, not stigmatizing, and so far, YES is a very key partner of in the drug field, and they're doing magazines on a monthly basis, again in a language which can be understood and which is highly appreciated by other drug users, and this is done on a monthly basis with top topics which are of key interest for drug users. But also international magazines of drug users do exist in other countries. Here we have the Junkfurter Ballergazette, which is a Frankfurt specific brochure or magazine, also written by drug users themselves for other drug users, but also in other countries this is being done. Also, YES is very active in the organization of the National Memorial Day for people who died because of overdose, drug-related deaths. It's the 21st of July. And this is a very key day in Germany where the awareness is being risen for the risks criminalized drug users are running in Germany especially. And 2019, this was the 30th anniversary of YES, and the whole network and the means, the material done by YES, it's being highly developed, and it is giving alarming signals to the federal policy and to the regional policy, with lots of material, strict to the point, and which is looking for something similar. The paradigm of YES is that in the early beginnings, it was said, here we have one coordinator, was coordinator in the late 80s and early 90s. It is necessary for those affected to organize themselves in spite of all difficulties associated with the AIDS crisis amongst intravenous drug users, despite all the suffering, illness, and death. What is the central consequence in the field of health policies? I think that is the opening up of the health services to self-help and to the competence of those affected, to a degree which is unprecedented in medical history here, and therefore also offers great opportunities for a reorientation of this somatically oriented medical system towards a holistic health policy, recognizing the competence of those involved. The process of self-organization of those affected is the change on the drugs field. That is very important. And Werner Herrmann, the coordinator here, in another statement said very clearly that the establishment of the network of YES will lead, in my opinion, to an interdisciplinary change of paradigm in the awareness and actions of professional aids and drug help services, in which the paradigm of freedom from drugs is on an equal footing with social integration and healthcare, with drug use accepted as a lifestyle. And there were many supra-regional networks of YES, Speakers Council with representatives from all regions in Germany. They meet once a month to discuss current problems and future activities. And of course, they are very important to formulate the strategic goals apart from the General Council. So it is the self-organization and of drug use is not without contradictions and failures, of course. We have to report about that as well. And that is due to inadequate representation of former drug users within the German AIDS help. The support often fails to go beyond lip service. So drug use involvement is set in so-called Sunday speech, but it's never been made real. So and people are suffering physically and psychologically from long years of living in illegality. And often we see a weakened motivation towards self-determination, difficulties to bring themselves in line with the norms of the society. And that is quite important.